Welcome to this training video titled, Balance Billing Policy for Medicaid Providers. This training will discuss the policy surrounding billing Medicaid members the balance of their medical bills. Topics for this video include: what is balance billing? Policy in the Medicaid Provider Agreement. Policy in the Medicaid Provider Manual. The No Surprises Act. Medicaid and third-party liability. House Bill 501. Bills Medicaid members are responsible for. And retroactive coverage.
What is balance billing? Balance billing occurs when a Medicaid provider bills a patient for the difference between the amount they charge and the amount Medicaid approves. For example, if a provider charges $200 for a service and the approved amount is $100, the provider is not allowed to balance bill the patient for the remaining $100 of the covered service. What does the provider agreement say about balance billing? This agreement can be found on the Utah Medicaid website. That URL is medicaid.utah.gov. From the Provider menu, select Provider Resources and Information. Select Forms. Click the Provider Form Directory hyperlink. Scroll down and click on the Provider Agreement PDF. In the Provider Agreement for Medicaid form, under the Provider Agrees to section, and in number 8, Prohibition on Billing Recipient, it says, Provider agrees to not bill the recipient or otherwise attempt to collect payment for services, except as specifically permitted by Medicaid policy. Provider may obtain the advance consent of a Medicaid recipient to see the recipient as a private pay patient for a given service, and to bill the recipient, so long as the provider does not bill Medicaid for the service. In the same paragraph, it also says, provider will accept payment or claims adjudication from department as payment in full for services rendered. For recipients enrolled in a managed care plan, payment from the plan is considered payment in full. Please review this provider agreement for other important agreements. The Provider Manual also contains important and helpful information regarding balance billing. To find the Provider Manual, navigate to the Utah Medicaid website. Under the Provider's drop-down, select Provider's Home. From the Provider's Home, scroll down and select Provider Manuals. On the Manuals page, select Utah Medicaid Provider Manuals. Under Directory Contents are folders for Utah Medicaid Information Bulletins and Utah Medicaid Provider Manuals. Click Medicaid Provider Manuals. Select All Providers General Information, Section 1. On the next page, select the All Providers General Info Section 1, PDF. In the Table of Contents, scroll to Provider Participation and Requirements, and click Medicaid as Payment in Full, Client Billing Prohibited. This policy says, a provider who accepts a member as a Medicaid, hospital presumptive, or baby or baby patient must accept the Medicaid or state payment as reimbursement in full. A provider who accepts a member enrolled by Medicaid in an MCO must accept the payment from the plan as reimbursement in full. If a member has both Medicaid and coverage with a responsible third party, do not collect a co-payment that is usually due at the time of service. The provider may not bill the member for services covered by Medicaid, hospital presumptive, or baby or by an MCO. The payment received from Medicaid or from an MCO is intended to include any deductible, co-insurance, or co-payment owed by the Medicaid member. In addition, the administrative cost of completing and submitting Medicaid claim forms are considered part of the services provided and cannot be charged to Medicaid members. Third-party liability in Medicaid. Medicaid cannot be the primary payer when there is third-party liability, also known as TPL. Bill all of the responsible third parties first, then bill Medicaid last. If the third parties pay the claim, submit a claim to Medicaid and show that TPL payment according to instructions. Medicaid bases any subsequent reimbursement on the Medicaid fee schedule. Medicaid will not make an additional payment if the amount received from the third parties is equal to or greater than the Medicaid reimbursement amount. In this case, the TPL payment is considered payment in full. A provider will not bill the member for any difference between the amount charged and the TPL payment received. If a provider receives a third-party payment and does not bill Medicaid for the balance, because he or she anticipates the Medicaid payment to be zero, the TPL payment is considered payment in full, and the provider may not bill the member.
Bills that are the responsibility of a Medicaid member. A Medicaid member is responsible for certain charges, including non-covered services that a member chooses to receive and agrees to pay for, those specific, non-covered services. Cost-sharing amounts such as premiums, deductibles, co-insurance, or co-payments imposed by the Medicaid program. Broken appointments. Charges incurred during a time of ineligibility. The specific policy for each charge must be followed before the Medicaid member can be billed. Refer to 3-5, Exceptions to Prohibition on Billing Members, and Chapter 7, Member Responsibilities in the Utah Medicaid Provider Manual.
Surprise billing. Surprise billing happens when a patient receives a balance bill after they receive care from an out-of-network provider or at an out-of-network facility, such as a hospital. It can happen for both emergency and non-emergency care. There are new protections in place for patients from receiving surprise billing. Protection from most surprise balance billing arrived in 2022, thanks to the No Surprises Act. This federal legislation was incorporated into the Consolidated Appropriations Act of 2021, which Congress passed in December 2020. A facility, such as a hospital or freestanding emergency room, or a provider may not bill a patient more than their in-network coinsurance, copays, or deductibles for emergency services, even if the facility or provider is out of network. If a patient agrees in advance to be treated by an out-of-network provider and knows the cost will be higher, the patient will be expected to pay the balance bill, out-of-network coinsurance, deductibles, and copays. Please refer to the CMS website for more information about surprise medical bills, including policies and resources, resolving out-of-network payment disputes, consumer rights, and protections. That website URL is cms.gov/no surprises.
Retroactive coverage. Most Medicaid programs allow applicants to request coverage for medical services for up to 3 months before the month they file a Medicaid application. A person who received medical, dental, or mental health services and subsequently becomes eligible for Medicaid may return to each provider with a Medicaid identification card for the month the service was provided. A provider who has already rendered services may subsequently choose to accept Medicaid as payment in full, or refuse to seek Medicaid payment, because the patient had not been determined eligible for Medicaid at the time of service. If the provider accepts Medicaid, Medicaid may pay for the service. If the provider refuses Medicaid, the patient is responsible for the charges. House Bill 501. Effective May 1, 2024, House Bill 501 from the 2024 General Session requires the Department of Health and Human Services to make rules to encourage healthcare providers to seek prior authorization, when necessary, from a health insurance entity that is the primary payer, before seeking third-party liability through Medicaid. And that health insurance entities are to respond within 60 days to any inquiry by the Department of Health and Human Services regarding a claim for payment for any healthcare item or service. Please watch for updates to these rules. That concludes this training on balance billing policy for Medicaid providers. For questions regarding this policy, please contact Medicaid Customer Service. That number is 801-538-6155, option 3, then option 2, and then option 2. Thank you, and have a great day.